Patients with inherited cardiovascular conditions may have few to no symptoms at all, but they still face a significant risk of heart disease, including sudden cardiac arrest. Thankfully, with new cardiac genetic testing, there is improved diagnosing and management. I'm here today with genetic counselor Cory Airheart. Thank you very much for joining me today. If we can start by talking about what exactly is genetic counseling and genetic testing.
Our primary roles are direct involvement with patients, a lot of education and clinical assessment just in different areas of genetics that we work in.
How does genetic testing help in a patient's health care?
Well, it depends on the situation. You know, in some cases it has direct effect on management. It can direct treatment, it can direct medication in certain conditions. In other cases, it's still, even if there's none of that, it's still very important just in terms of ending a diagnostic odyssey. And then there are developing fields such as cardiovascular genetics, which I'm involved in.
Great segue to cardiovascular genetics,
Sure.
which is your focus. Talk to us about that.
Right, so cardiovascular genetics is one of the newer specialties in genetics, and that has a lot to do with that technology. With the hereditary cardiovascular conditions, most of them have a list of genes that can cause the same condition. If I see somebody for a concern for hypertrophic cardiomyopathy from a hereditary standpoint, I may be ordering sequencing on 30 different genes. Now, prior to next-gen sequencing, our new technology, that would have been completely cost prohibitive. There would have been tens of thousands, if not a couple $100,000 to do that testing. Just couldn't do it outside of a university research type setting. Now I can order that panel for about a $200 cash price for a patient.
And so how does that help your patients?
Similar to what I talked about earlier, it depends on their situation. There are many of these conditions that, depending on the gene that the mutation is identified in, it can change the specific approach to their treatment. Some of the arrhythmia conditions where a patient may need to have intrathoracic cardiac defibrillator, the jump starters implanted. Depending on the gene, that may move up when they would do that, or lower the threshold for when they would put one in, because certain genes have a much higher risk of having an event, which the events in those conditions can be sudden cardiac arrest.
Thank you for all your hard work.
Oh, thank you.
Thank you, Cory. Not everyone is a candidate for genetic testing. There are certain criteria that vary on a case-by-case basis. To learn if you are eligible, talk to your physician.